into this space to get recorded. Are you feeling nervous?
No, I've since transitioning, I've become all the social anxiety's gone.
Meet Rosalia. She's in her mid-20s. She loves chess. She thinks Tasmania is the greatest place on earth, and who can blame her? And she's transgender.
Also, I'm usually very confident talking to people. Transitioning is a lifesaver. Would recommend it to anyone who needs it.
For Rosalia, one of the most important parts of transitioning was being able to find a GP who would help her medically affirm her gender.
I was very socially anxious and was convinced that I was just introverted, and that couldn't explain why I was nervous around everyone. But no, it was just because I wasn't comfortable the way I was presenting myself, not comfortable in the body that I was in. So transitioning kind of helped me be myself.
So Rosalia, along with that social anxiety, can you tell me a bit about living with gender dysphoria? And does that change when you come out?
At least in my experience, before you come out, you cope with dysphoria very differently. It's a very subtle thing because you've been dealing with it for years, and it's too shit to have to deal with it in the extreme way. I remember when I was very young, maybe 10, 11, 12, I had the extreme feelings of dysphoria. But then teenage years, you just cope with it and you just kind of put it to the back of your mind. But when you come out, suddenly your euphoria of being recognized as the right gender is incredible, but then the dysphoria also becomes really crippling. So it's like my legs go to jelly, my stomach does fall, I get lightheaded, I start having a panic attack, I feel like I'm being threatened, I feel like I'm being judged and I need to justify my existence. It's terrible. I wouldn't wish dysphoria on anyone.
Imagine living with that every day. Now, gender dysphoria is not a universal experience for all trans and gender diverse people, but it's super common and super hard to live with. And while not all trans people may want or need to change their body, for a lot of people, medical transition is a game changer. And that's certainly how it was for Rosalia.
I was on hormones 3 months after I came out, which was fantastic, just because, I've felt this way since I was very, very young. So it's like, it made sense. And I was like, well, I'm not letting anyone slow me down. So I'm going to keep running and running and running until I get to the finish line.
Hi, I'm Lucy and you are listening to Speaking of Health. And when we set out to make these episodes, we had a particular focus on women's health services and what it means to make these spaces inclusive. But when we spoke to trans and gender diverse people about what they wanted included in these episodes, they told us that being able to medically affirm their gender was really important. And accessing it, well, it's a bit of a minefield.
Yeah, it's a very different story. You usually hear stories of people who found out, they came out and they couldn't get it for years. In my case, it was euphoric because informed consent, I didn't feel like I was being gaslit or being told, oh, are you sure? It's like, I felt, respected and okay, we'll help you through it.
Rosalia is one of the lucky people who was able to access what she needed pretty much as soon as she came out.
Do you know the joke about how many trans women does it take to change a light bulb?
No.
Just one, but it takes 3 people to tick it off to confirm, in fact, that the light bulb is off and not working. That's what it feels like transitioning under an older system, where it's like, it's not working, you can fix it. But you need 3 people to approve it because they're not sure if it's true or not.
In this episode, we are going on a deep dive into the informed consent model of care for trans and gender diverse people. This is an area of medicine that is surprisingly unrevolutionary, and our guide is one of the most qualified GPs out there.
My name is Dr. Portia Predney. I use she, her pronouns. I'm here in my capacity as the Vice President of Auspath, which is the Australian Professional Association for Trans Health. And I'm also here as a GP who does a lot of work in healthcare for trans people.
So, Dr. Portia, tell me, what is gender affirming care?
Yeah, so that's a really good question. And I think that there are two important sort of subcategories under gender affirming care, at least in terms of my definition of the term. As an overall term, gender affirming care refers to medical care that's provided to people that takes the position that gender diversity is not a pathology, it's not a disease, it's not an illness, it's certainly not a mental illness, but that being trans is part of the normal, healthy, and wonderful spectrum of human diversity that has existed throughout all of history, throughout all different cultures, all around the globe. And by taking that baseline position, gender affirming care seeks to do a couple of things. So one is to provide holistic medical care for people who are gender diverse in the same way that we would provide holistic medical care for a cisgendered population. So high quality care, treating the concerns and issues that someone is coming in with and not treating a person differently because of their gender identity or presentation. And then as a additional facet of that care, gender affirming care can refer to specifically the prescribing or administering of medical and surgical treatments that help a person to affirm their gender identity. So that help someone who is gender diverse to bring their appearance or their experience, their lived experience, better in line with the gender that they identify as. So it might include prescribing hormone therapies or hormone blocking therapies. It might include specific therapies that are designed to change particular symptoms. For example, for a trans man, a major source of dysphoria could be that they're menstruating. And for people who are trans men or trans masc, in that context, we might look at specific therapies like treatments that will stop menstruation, so things like Mirena IUDs, etc. And it also can include sometimes surgical therapies, which, depending on your role as a clinician, you might be referring people on for those, or you might be the person performing those surgeries.
Okay, so let's just recap. There are two aspects to gender affirming care. One is general care of trans and gender diverse people, holistic care, so you can be trans and have the flu or diabetes or be pregnant. But also, trans people may seek care from a GP to help them affirm their gender with medical treatments. If you're providing gender-affirming medical treatments such as prescribing hormones, or perhaps you're referring someone for surgeries and so on, you use a model called informed consent. Can you tell me about this and why is it important for trans and gender diverse healthcare?
Yeah, great. So I guess if we look at informed consent first, the informed consent model of care is essentially, I guess, a natural progression of gender affirming care in that it is rooted in the position and the belief that gender diversity is normal and healthy, not something to be pathologized. And the informed consent model of care basically centres patient autonomy and the right to self-determination in decision-making around medical and or surgical treatments that a person might choose to access in order to help them with affirming their gender. Essentially, the informed consent model of care is the same type of practicing medicine that we do as clinicians every day with all of our patients when we are proposing any kind of treatment, be that medical or surgical, where we sit down and we have a conversation with them about what that treatment is, what we would expect the effects of the treatment to be, what some of the side effects or risks might be, and then come to a shared collaborative decision with that patient about whether or not that treatment is right for them, based on their goals, their concerns, and their personal individual risk profile.
So, Portia, it sounds like you're really aiming to treat medical affirmation in the same way that you'd treat other medical interventions.
I think realistically that informed consent is just good medical care. It's just applying it to a population that for many years have been pathologized and have been forced to work through specific barriers that have been put up in the way of them accessing the medical care that they need. So barriers such as psychological and or psychiatric assessments that they've had to undergo prior to starting on hormonal therapies or having any surgical treatments done. I think the informed consent model is a really appropriate model to use for just about any adult patient, as long as you're comfortable as a clinician that that person has the capacity to give consent. So the capacity to understand what you're talking about with them and to grasp the implications of the therapy that you're discussing and, have a really good understanding of the possible side effects and risks. And if they are aware of those things and you assess that they have the capacity to make that decision for themselves, then there's no reason why you shouldn't be able to use the informed consent model of care.
This is a really good time for me to jump in because people often have questions about medical transition and young people. There's some really useful guidance around the legal frameworks for working with people that are under 18 in Auspath's informed consent guidelines and also in their children and adolescents standard of care. We've popped those in the show notes for you so you can look them up. The short and highly simplified story is that it's a much higher bar that people under 18 have to clear to be provided with any medical affirmation. And it depends on the state and territory you're practicing in as well. It's such a big topic on its own, so we're not going to cover it today. We're just talking about transgender adults. So Portia, you've been doing this work for some time now. You use the informed consent model in your work, but can you tell me, how did you get started on this path and what was that like?
I think if I go right back to the beginning, there were definitely moments of feeling a bit overwhelmed. So the path by which I found myself working in this area in a really very intense way with a lot of patients under my care, I had started working in a new clinic, and about 5 or 6 months into that placement, I discovered completely outside of work spheres that the main clinician in the Sydney and realistically in the New South Wales area who'd been providing gender affirming care had suddenly retired with no warning, leaving quite literally thousands of patients suddenly without access to their treatment, leading to a lot of panic, understandably, within that community. And I found out about this through social circles and reached out to a person working within ACON. And ACON is the old AIDS Council of New South Wales, but basically is now a hub of queer health provision and advocacy within New South Wales. So I reached out and said, look, I'm a GP. I've heard about this happening. I don't know that much clinically in this area. I've had a few patients who are gender diverse who've asked for referrals, and I've happily provided them and looked after their general care. But that's about the limit of my experience. But I really want to help. And if there's anything I can do, please let me know. I definitely volunteered, but I volunteered in a sense of perhaps not having a full understanding of of what I was volunteering for.
This might sound familiar to us here in little old Tassie, where one clinician retiring can leave a huge service gap. Portia and a small group of health clinicians and community health workers set about offering to help patients with medical affirmation care. It was a steep learning curve.
I went from a GP who'd seen a few trans patients that I was aware of and had occasionally provided referrals when they'd requested them, otherwise just looked after their general health care, to suddenly being someone who probably 70% or more of my books consisted of a lot of new patients and primarily gender diverse patients coming in and seeking my care. The medicine side of it, while that was the bit that made me the most worried and the most anxious and the most hesitant about putting myself out there, actually turned out to be really the easiest part. The medicine itself is not that complicated. That's the big secret. But the patient-centered care, which is so important for all of our patients, is, as it is with all other patients, the challenging part, just looking after the individual and their specific needs.
You must get so many questions from GPs over at Auspath. Portia, tell me, what is the number one big thing that people want to know?
How do I get certified to do this care? How do I get the necessary knowledge so that I can be a gender-affirming clinician? And I think that is a very understandable question, and it's a question that, I was asking myself when I first started doing this kind of work. I was like, is there a course that I can do? Is there a certificate I can get? Is there some bit of paper that tells me, yes, I'm a safe clinician to be a gender-affirming doctor, and I can now officially prescribe these medications and not have anyone tell me I'm doing the wrong thing? Whether it be a good or a bad thing, and I think there are arguments on both sides of that spectrum, there is no certification for being a gender-affirming doctor. Personally, I think it's actually a good thing that we don't have barriers to becoming a clinician who can provide gender-affirming care, because it is something that is needed by a large enough portion of the populace that creating extra degrees, extra qualifications before people are able to, step in and start doing the work, I think would probably just delay things further in people being able to access what is very necessary medical care.
So while there's no certification or barriers to GPs doing this work, what trans and gender diverse patients tell us is that it can be very hard to know which GPs understand informed consent as a model of care and will support their trans patients to medically affirm their gender. And it means that a lot of this work falls to a handful of practitioners who clearly flag that they work from this perspective. It's something that Rosalia experienced firsthand.
With me finding my current GP and the clinic, it felt like I had to find a crack in the system where my particular shape would fit in. And even now, there are so few people that in the state that do it in an accessible way, where it's very clearly telegraphed and doesn't feel like I have to go read several hundred internet pages to find out where they are.
Let me know if you don't want to speak to this, Rosalia. Did you ever bring up with that first GP, did you ever speak to them about transition?
No, because I was so paranoid, because I didn't want to be told that, no, it's something else. I didn't want to be gaslit into thinking, no, you're not trans. How long have you been thinking this? That's not long enough. It's I was so paranoid about that, I didn't feel confident or comfortable to go to my previous GP, because I had no idea. I just needed to know up front, does this GP do it? If you do it, tell me, because I can't read your mind. I can't figure out if you're okay with it, and I'm too scared to ask you. So if you say it first, then I know, and that's kind of how I found my current GP and how other people have found other GPs as well.
But I definitely understand the anxiety that a lot of clinicians feel about doing something new for the first time. At each stage of our progression through our career as clinicians, I think it's natural for each stage to come with some anxiety about the new work, the new knowledge, the new experience that we're expected to have, or at least expected to build. A lot of us, being, the personality types that tend to get attracted to doing medicine, I think we really like the sense of security that comes from having a bit of paper that says, hey, this person's read some books and passed some tests, and we've determined that they are a safe clinician. There's no certification, but there are plenty of educational resources that people can access. And I think that that's the important thing to be aware of, because I think the other thing that we're quite good at as doctors is self-directed learning. It's something that we have to learn from early on, and it's something that we have to use throughout our career paths.
Self-directed learning is the go-to. And you can check out the show notes for resources, as well as listen to our previous episode with Dr. Miranda Hahn for Tasmanian resources. But in all the busyness of GP life, why would a GP embark on providing what could feel like, at the moment, an additional part of work?
One of the things that happens in health for all of us, I think, is that we often go into healthcare and start our degrees in medicine thinking, I really want to do good in this world. I want to make a difference, with all of these very grand ideas about what we're going to do once we graduate and start working. And I think for a lot of us, we can find that the daily grind of what medicine as a career actually involves takes a bit of that away for us, or sometimes takes a lot of that away. And I have to say that since I started working in the area of gender affirming healthcare, I've actually found that passion for work has really come back, and that sense of making a difference and doing something that's really rewarding for my patients and for myself is a really prominent part of the work that I do. And so it makes getting up and going to work every day feel worthwhile.
Rosalia, when you found your GP who was able to work with you, what was that like?
So it was kind of that feeling again with informed consent, where I was like, oh my God, it could work. Like, I can do it. It's life-saving treatment for a lot of people. I'm sure I'm not the only one. I used to say that I'll never make it to 20, and I didn't in a way because I transitioned when I was 19. I have hope because that's where we're heading, and I think the main way of seeing that is just seeing how happy patients are and how big of a difference it makes in the rest of their lives.
If you're a GP, you can use an informed consent model of care to help your patients access gender-affirming treatment. Yes, just little old you. This episode is all about the additional reading, so check out the show notes for links to Australian resources about medical affirmation. A huge thank you to both Rosalia and Dr. Portia, and a big thank you to you, dear listener. If you ever want to reach out to us, let us know what you think of this podcast. Maybe you have a recommendation, an idea, or something you reckon we've missed. We would love to hear about it. If you thought this podcast was useful, interesting, or if you know someone who really needs to hear it, please share it. Or even better, rate and review it so that other people can find it more easily. Women's Health Tasmania made these podcasts in partnership with Working It Out, Tasmania's sexuality, gender and intersex support and advocacy service. The topics in this series were chosen by our crack team of trans and gender diverse advisors, and our music was composed by Chloe Allison Escott. This podcast is made in Lutruwita, Tasmania. Always was, always will be Aboriginal land.